and I'm going to pass it over to Michelle Hayden with KDADS to get us started.
Yeah, good afternoon, everyone. Welcome to this pretty warm October day. Feels more like summer than October. But we're really glad you're here. Audrey Davis is going to run our stakeholder engagement, and Peter's going to help with communications. And Elion Sorensen is going to be going over person-centered service planning, reserve capacity, and CMS conflict of interest requirements and compliance. So I will turn it over to them, and I'll stay on to help answer questions.
Thank you so much, Michelle. So like Michelle was saying, we're going to be going over Appendix D updates and also conflict of interest updates and going over Appendix D. We'll have moments to pause for questions after each topic, and then we'll wrap up and talk about future meetings. I'm going to pass it over to Elion to get us started.
Thanks, Audrey. I'm going to get us started with some updates to Appendix B of the CSW application, which includes the section on reserve capacity. KDADS had previously shared a decision to reserve 200 spots on the CSW for IDD waiver participants who wish to transition to the CSW. However, KDADS has decided now to reduce that number to 25 spots per year. So 25 spots on the CSW will be held as reserve capacity for people who are currently on the IDD waiver and who want to transition to the CSW. This decision was made because reserving 200 spots could impede CSW enrollment, primarily if fewer than 200 IDD waiver participants want to transfer to the CSW in any given year, then those spots would be held and not able to be used by others interested in getting services on the CSW. However, if needed and depending on interest in the CSW, KDADS can always decide to add or remove reserve capacity spots in the future. I will pause here just to see if there are any questions on that update for reserve capacity before I go on to conflict of interest requirements.
So we have one person, Elion, raising their hand. Craig, if you'd like to go ahead and ask your question, you should have the option to unmute now.
Yeah, so quick, I'm just kind of curious. Do we have any data showing how many people have expressed interest from moving from the IDD waiver to the community supports waiver that would, I'm just curious if like there was an overwhelming amount of people who they were wanting to move from the comprehensive waiver to the community supports waiver. That's why they decided to roll things back, or if it's just the idea that we only have a limited number of slots on the community supports waiver to begin with. And that's why they decided to roll back the amount of people. And the reason why I bring this up is that the special committee, I believe it was Seth, said that roughly 1/3 of the people who are on the community supports waiver only utilize about, I believe it was $30,000 in Medicaid claims. And so, I mean, if we could open up a lot of slots on the comprehensive waiver, you know, that would address a lot of our waiting list issues as well if we can move them over to the community supports waiver.
Yeah, it's a great question, Craig. And I appreciate it. I think there's kind of a couple of factors here. There isn't, I would say that KDADS doesn't have specific numbers on estimated interest of IDD waiver participants who might want to transition. But the initial number was identified in part based on that figure that you cited, that a number of people on the IDD waiver are currently not using the waiver to its fullest, don't need all the services that it offers. And so we can presume that many current participants could get their needs met on the CSW, which would free up space, as you say, on the IDD waiver and the wait list. And so that was definitely the initial kind of rationale there. But given that, you know, we can expect that some IDD waiver participants may be hesitant to transition initially, maybe concerned about, you know, kind of the differences in services or if all their needs will be met, and knowing that the wait list to get back onto the IDD waiver could be long, that KDADS didn't want to over-reserve space on the CSW and have that impede access. So if it turns out that large numbers of IDD waiver participants are interested in transitioning, I think KDADS is certainly interested in considering updating those reserve capacity numbers to facilitate transition later on, but didn't want to kind of over reserve that space in the event that, especially in the first couple years of the CSW, when people are still getting familiar with the differences and kind of the confidence in the CSW is still growing, that maybe more space would be needed to reserve later on, but didn't want to impede that access. Initially, I'll also flag that KDAD's plans to prioritize enrollment on the CSW based on duration of time on the IDD waiver waiting list. So the people who are on the waiting list for the IDD waiver and have been on it for some time will have priority access. Their applications will be processed ahead of others who have not been on the waiting list, which is just another tool that Kansas is planning to use to help facilitate a reduction in the IDD waiver waiting list.
Thank you. And then too, if I can just put sort of a point on what you just said. I mean, the risk would be that we reserve capacity and then these slots go unused. Am I stating that correctly?
That's right, Peter.
Gotcha. So, based on the tools Elian just laid out, KDADS does have ample opportunity to help, use the CSW to decrease need on the IDD waitlist, as we said, without running that risk of slots going unused if we formally label them as reserve capacity. Elian, we have another question in the Q&A now. Just give me a moment to read it. Yeah. So Mike Burgess is asking for other categories KDADS is considering for reserve capacity. Elian, I know we reviewed these in a previous town hall. Do you happen to remember offhand which one that is that we could direct Mike towards?
I don't, but I can read out the numbers for you really quickly. So I can say that there are, in addition to the 25 spots for the IDD waiver, KDAD's plans to reserve 20 spots for children who are in custody of DCF, so children in foster care in DCF custody. 2 spots per year for military immediate dependent family members and military participants. Reverse those 2 military participants and their immediate dependent family members. 2 spots per year for children who are no longer eligible for the technology waiver, and 5 spots per year for participants no longer eligible for the brain injury waiver. And then 65 spots in the first year and the second year for children who are on the autism waiver and are eligible to transition. That number will be 0 in year 3 as Kansas plans to phase out the autism waiver. And then 5 spots per year for works program transitions, which includes both people who are on the CSW who then go into the works program and wish to transition back to the CSW, as well as IDD waiver participants who enter the works program and then wish to transition to the CSW. Additionally, 15 spots per year for institutional transitions and 10 spots per year for those with temporary institutional stays. That's defined as 60 days or less. I know I just ran through those really quickly. I believe we have shared those at a previous town hall in the August town hall. So that should be available on the CSW website as well.
Thank you, Elian, for listing those out. And thank you, Jackie, for tracking down. As Elian said, it's that August 2025 tag presentation on the website. And if you do visit the site, they have descriptions of very generally what each of these town halls covered. So you should be able to track it down there. Linda, I see your question in the chat about sort of, what you should do with respect to your situation in the IDD. We appreciate the question. We absolutely want to help you. I just don't know if the town hall is the right forum for us to address that right now. So if you want to shoot us an email to the CSW email address, I'll make sure I drop that in the chat. We'll be more than happy to help you on a more one-on-one basis when we can do a little bit more direct and guided discussion. And that's all the questions for now. I think we're ready to move whenever you are, unless you had anything else to cover.
That sounds good. Thanks, Peter. So I will next jump to compliance with CMS conflict of interest requirements. And I just have a couple slides about background information here to make sure that we are all on the same page. And then I have some updates from Kansas about the status of developing a policy to come into compliance with these conflict of interest requirements. So CMS, that's the Centers for Medicare and Medicaid Services, that's the entity that approves Medicaid waivers. They prohibit entities or individuals that have a responsibility for service plan development or service plan monitoring and implementation from providing other direct waiver services to the participant. So what that means in practice is that a participant can't receive TCM and direct services from the same agency or entity. KDADS is working to ensure compliance with this policy, which means both making sure that the CSW is compliant from day one, as well as figuring out what steps are needed to ensure that Kansas's other waivers also come into compliance with this requirement. KDADS does plan to allow agencies to provide both TCM and direct services, so long as those agencies do not provide both to the same participant. However, in some cases, primarily in the event of provider shortages, it may not be possible for a participant to receive direct services and TCM from different agencies. In these cases, KDADS plans to allow exceptions to the conflict of interest requirements when a provider is the only willing and qualified provider in the geographic area. So that is when no one else is available and a participant either can receive conflicted services or no services, KDADS does plan to allow the delivery of conflicted services. However, in general, when another provider is available, the participant will be expected to receive either their TCM or the direct services from a second agency. So this slide shows what the text of the waiver application. And so you can see there are two options here. States can either select that first option that says that the entities or individuals who are responsible for developing a service plan can't provide other direct waiver services, or they can select the second option, which says that the entities or individuals responsible for developing a service plan may provide other direct services to the participant. And if a state selects that second option, they have to explain how that waiver service provider is determined to be the only willing and qualified in a geographic area who can develop the service plan. So KDADS is developing a process for agencies to apply for exceptions when they are the only willing and qualified provider of both direct services and TCM in the area. Now, when a state selects that second option, they also have to check these following checkboxes. And these are attestations that the state has safeguards in place that will protect participants in the event of conflicted service delivery. And so the state has to say, yes, we have all of these things in place. And I'll just kind of quickly read out what those safeguards are. So the state needs to ensure full disclosure to participants and an assurance that participants are supported in exercising their right to free choice of providers and that they are provided information about the full range of waiver services, not just the services furnished by the entity responsible for developing their service plan. There also needs to be an opportunity for the participant to dispute the state's determination that there is not another entity or individual that is not the individual's provider to develop the service plan through a clear and accessible dispute resolution process. So a participant has to be able to dispute the determination that their only options for receiving services is from a conflicted service provider. There needs to be direct oversight of the process or periodic evaluation by a state agency. There needs to be a restriction of the entity that develops a service plan from providing services without direct approval of the state. That is, nobody can deliver conflicted services unless they have been approved to do so. And there's a requirement that the agency that develops a service plan administratively separate the plan development function from the direct service provider functions. KDADS is working to develop these safeguards and ensure policy is in place for full compliance with these safeguards. And I have just a couple slides of updates for you on kind of the status of that work so far. So KDADS, with the support of PCG, has organized a policy alignment team, which we are calling the PAT. It's made up of providers and other stakeholders, CDDOs, MCOs, et cetera. And they are responsible for helping develop the policy and processes to ensure compliance with CMS conflict of interest requirements. So specifically, the PAT is providing feedback on an exception policy. This is a policy that will allow some providers to deliver both TCM and direct services to the same participant when no other providers are available. And the PAT is also helping develop safeguards and monitoring requirements and a policy to ensure that no participants receive conflicted services unless their provider has received KDAD's approval. So I have some initial decisions to share with you all based on the work of KDADS and the PAT. Again, as more developments are made, KDADS will share those going forward. But to start, the plan is that CDDOs will apply on behalf of any affiliated providers who may need an exception, and that exceptions will be approved on a per provider, per county basis. So the CDDOs will be the entity responsible for submitting applications on behalf of their providers, and those providers will be approved in a limited area to deliver conflicted services. Applications will not be approved if there is another willing and qualified provider who's affiliated with the CDDO. And that means that CDDO applications have to include documentation that the CDDO has surveyed their affiliated providers and found that no other providers are willing or qualified to provide either TCM or direct services to the participants of the provider requesting an exception. Now, providers may be considered not willing if they don't have capacity, if they don't provide the service or services in question, if they don't serve that area, or for some other reasons that would preclude them from stepping in to address the potential need for conflicted service delivery. Additionally, exceptions will be granted for 1 year with the opportunity to reapply. But exceptions may be revoked at KDAD's discretion, such as if the CDDO or provider fails to follow certain reporting requirements or meet other safeguards. When new providers enter an area, existing providers with exceptions will be able to maintain their exception to give new providers time to become stable. But the specifics of that and these other policies are still being worked out. I have here really just a high level overview of the decisions made so far. And the intent is to be able to share more specifics with you as those details are finalized. So I will pause here to see if there are any questions or comments that I can take about these couple slides.
We got at least one hand raised so far, Elian. So Debbie, if you'd like to go ahead, you should be able to unmute and ask your question now.
Okay, thank you. I've been following the PAT notes, and does anyone in this group know? So the CDDO is going to be the one doing the application for the providers, but how are they going to address the conflict? Because a lot of CDDOs are also CSPs.
Yeah, that's a great question. So there are a couple answers to that question. The first is that the primary focus of the PAT right now is on the CSW, which isn't to say that KDADS isn't also working on eventual IDD waiver compliance. But right now, the key priority is making sure this policy is in place for the CSW, so that the waiver application can be submitted and people can start getting services on it. And because the CSW is a new waiver, it should begin operation conflict free, right? So even if a CDDO is in conflict on the IDD waiver, they're delivering conflicted services on the IDD waiver, they themselves will not be able to be in conflict on the CSW unless they've been approved in advance, because everybody new on the CSW will be new to the CSW. That said, there are situations in which the CDDO may be applying on behalf of themselves. That's true. And in those instances, they will still need to provide attestations that no other providers are available, and KDADS will be responsible for reviewing and approving that application. And KDADS, reserves the right and ability to conduct any additional investigation or oversight to determine that the CDDO's application is really needed. So they could contact other providers, they could reach out to that CDDO, they could see who else is around, really making sure that if a CDDO is applying for a conflict, for the ability to deliver conflicted services themselves, that's really needed. So the KDADS will still have that oversight authority.
Elian, oh, please continue your question.
Yeah, can I ask a second question?
Yeah, absolutely, Debbie.
So the only willing qualified providers, hopefully I kind of state this correctly. So I currently provide TCM, but I'm also part of a provider that has CSP. Our service providers provide a lot of services to individuals that I would say have profound medical needs. such as like a feeding tube. And there isn't a lot of service providers that do that in the state of Kansas. So there would probably be, as far as the residential service go, not a lot of willing or qualified providers to do that. And so individuals would want to stay with their residential, stay with our service provider for residential because of how knowledgeable we are on profound medical.
Mhm.
With that being said, because we serve a lot of those individuals as a TCM, I also have a lot of knowledge on profound medical. So if there is no willing and qualified providers for the residential side, but a guardian wants to also stay with me as TCM due to my knowledge and background and history of their child's or loved one's medical history, will that be able to also happen? So if there's no willing and qualified providers on the residential side, how does that affect the TCM side?
Yeah, I appreciate that question, and I want to caveat it a little bit, both by saying that the policies KDAD is working on developing that I'm sharing with you all today are not final decisions. They haven't been approved by CMS. So what we're sharing is sort of, a draft roadmap, but nothing I'm saying here is at all set in stone. So that's the first caveat. The second is that, again, because these policies are at this moment primarily focused on ensuring the CSW will be approved by CMS, and the CSW does not offer any residential services, this specific question may be more relevant down the line when Kansas is working on ensuring IDD waiver compliance. So those are my two caveats. But then to answer your question, it is certainly possible that in that circumstance, if there are no other available direct service providers, no other willing and qualified direct service providers, then the question is there another TCM who is available to take on those participants? And if another TCM says, yep, I'm able to do that, I'm in this area, I have capacity, the presumption would be that those participants are expected to transition to that available TCM. So they are no longer receiving conflicted services. It is an ongoing question, and I'll say that it's ongoing in terms of what additional need for exceptions might be for people with kind of specific experience, or on the other hand, will there be the ability for providers to say, like, I don't serve that participants with this type of need, so I'm not available. I think those kinds of questions are still being hammered out. But big picture, yes, if another TCM indicates that they are willing and able and qualified to take on those participants, the expectation is that anybody who can be transitioned to receive non-conflicted service delivery does so.
Thank you.
Oh, yeah, thank you, Debbie, for the questions. If anybody, I'll take this opportunity. I know we've talked about the PAT for a little while now. For anyone who might be unfamiliar with what the PAT is, that just stands for Policy Alignment Team. It's a group of policy creators, stakeholders that I know Elian went over it, but just to reiterate, because this is the CSW meeting, and I've posted in the chat for anyone who wants to review those notes that we've mentioned. You can find it at that link there. We post them. The meetings happen weekly. We try to get them up as soon as we can. So there's about 3 or 4 left over. To answer your question, Andrea. A question from an anonymous attendee. Elian, this is about timeline. The question asks, what is the timeline for TCM? I imagine the question is asking, what's the timeline for these conflicts of interest protections? So I know, as you said, we're really working on this to get the CSW approved by CMS. So these protections need to be in place before CMS reviews for that CSW to get approved. But is there anything else you'd like to add regarding that, Elian, before I throw it to KDADS?
Yeah, so KDADS needs to have kind of be able to tell CMS that this plan exists, that they are prepared to have these safeguards in place, et cetera, when they submit their application. CMS, they don't need to be necessarily active at that point, but by the time the CSW goes live, once it's approved and ready to become operational, all of these things need to be in place, and nobody can be receiving conflicted services unless they've been approved to in advance, right? In terms of the IDD waiver timeline, not able to share, any specifics right now in terms of, when these compliance changes will need to go into effect.
Thank you, Elian. All right, I think in the interest of time, we'll continue Actually, I apologize. Michelle, I know I said I was going to give KDADs an opportunity to weigh in on the timeline. Is there anything you'd like to add before we do move on?
No, thank you. Elion covered it very well.
Excellent.
But our biggest push is to get the CSW out. These changes are going to also impact the IDD waiver as it stands currently. So we're looking towards that as well, before we have to renew that waiver in 2029. So, but we don't have a timeline for this specific requirement.
Sounds good. Then yeah, Elian, I think we can continue to move on to make sure we get through the Appendix D we planned for today.
Sounds great. Thanks, Peter. So Appendix D of the waiver application covers person-centered service planning, and I have some updates for you all about the service planning changes. KDADS has made several changes to the service planning process to better align the roles of TCMs, MCO care coordinators, and CDDOs. For now, these changes will apply only to the CSW. I'm not announcing right now any changes to the IDD waiver, but I will flag that in the big picture, in the long run, the plan is that the service planning process is aligned between the waivers, which would mean that what I am sharing about the CSW will eventually relate to the IDD waiver. But again, my focus today, this conversation, is very much specifically on just the CSW. Additionally, the following slides cover the service planning process that needs to be described in Appendix D of the CSW. In future meetings, we plan to provide further information about changes to the other waiver appendices based on these changes to the person-centered service planning process. But I'll also just say that these slides are not a comprehensive summary of all the changes that are being made to the roles and responsibilities of MCO care coordinators, TCMs, and CDDOs. Again, I'm only talking about what needs to be written to in Appendix D of the CSW application. So with those caveats in mind, I have on this slide a big picture overview of the service planning process, and then in the following slides, I'll get into each of these steps in more detail. But first is intake and eligibility. The CDDO is responsible for assessing an individual's functional eligibility using the Medicaid Functional Eligibility Instrument, or the MIFI. KDHE and KDADS confirm eligibility and approve waiver enrollment. CDDO documents the individual's choice of institutional care, or HCBS, and the individual selects a TCM if they do not already have one. Once all of these steps are complete, the participant is then able to begin working with their TCM and their MCO care coordinator to complete the needs assessment and develop a person-centered service plan, which, as needed, includes a behavioral support plan. Next comes the provider and service choice part, where the CDDO helps the participant make an informed choice of service providers, and the TCM schedules transition meetings between participants and providers. And once all of that is complete, then service delivery can begin. On an ongoing basis, the TCM and the MCO care coordinator monitor to ensure that services align with the service plan and that the participant's needs are being met. The CDDOs are also responsible for monitoring providers and service delivery. Annually, the CDDO reassesses participants' eligibility, and once that eligibility is renewed, then the TCM and the MCO care coordinator meet with the participant to review and update the person-centered service plan. For intake and eligibility, the CDDO assists individuals interested in receiving CSW services by determining programmatic eligibility, conducting the MIFI level of care assessment to determine functional eligibility, and referring the individual to KDHE for Medicaid eligibility determinations. The CDDO informs the person of their right to receive either HCBS waiver services or institutional services, and they document that choice on the IDD1 form. If the person doesn't have a targeted case manager, the CDDO helps them select one. And if the individual is eligible for the CSW, the CDDO will inform them of their options for receiving CSW services, and they'll explain the waiver, the budget limit, and available services. Once all of that is complete, the CDDO will upload all the documents to CAMUS, and the participant will begin working with their MCO and TCM. That brings us to the service planning process. I have 4 slides here covering that. KDADS has decided to streamline the service planning process by developing a single person-centered service plan. So this single plan will replace the current person-centered support and service plan. So instead of having those 2 plans that combine to form a kind of comprehensive plan, there will just be one service plan. The intent here is to increase consistency and reduce the burden on participants. During or prior to the person-centered service plan meeting, the care coordinators will conduct a needs assessment using the Inter-RAI tool. And then the TCM will be responsible for developing the service plan using the needs assessment and other materials such as the MIFI. And the TCM will provide a copy of the person-centered service plan to each of the participants' providers. In the event that a participant, a tribal member, chooses to enroll in the fee-for-service Medicaid program, in which case they would not have an MCO care coordinator, then KDAD staff will complete the responsibilities of the care coordinator. And for participants who do not have TCMs, care coordinators will be responsible for completing the TCM's responsibilities. Get into some more specifics here. The TCM will organize the person-centered service plan meeting, including scheduling, inviting providers and informal supports, and helping the participant lead the meeting. The participant can determine which members of their care team are present for the service plan development meeting. These meetings typically include the individual, their legally authorized representative, if applicable, the care coordinator, the TCM, and providers. And the TCM is responsible for informing participants about training opportunities or other resources to help them become more active in the planning process. The person-centered service plan is updated at least annually, as well as when any changes arise or whenever the participant requests an update. And the TCM has to obtain a signature from the participant or their legally authorized representative before implementing the person-centered service plan. The person-centered service plan is based on documentation from the participant eligibility assessment, that's again the MIFI, and the MCO needs assessment. The needs assessment captures the participant's service needs and health status in more depth. And the final service plan will document the scope, duration, and amount of services authorized for the participant, the participant's care needs, preferences, goals, and priorities in their own words, and all current providers, informal supports, and others that the participant would like included in their care. The TCM is responsible for collecting provider signatures on the service plan, and the MCO is responsible for ensuring that all signatures are present before authorizing the plan. The care coordinator approves the plan and ensures that all services in that plan are authorized before service delivery begins. The TCM is responsible as well for developing a backup plan or a disaster/emergency plan for the participant. And if needed, the TCM will also develop the behavior support plan or BSP. For participants whose BSPs include restraints or other restrictive interventions, the TCM establishes a behavior management committee. I know in Kansas that's also called a human rights committee. And in the event that a participant does not have a TCM, then the care coordinator will be responsible for organizing the BMC, which can include coordinating with providers as needed. Get into provider and service choice. I have a couple slides here. CDDOs are responsible for providing options counseling to participants by advising them of the services and providers available to them in their area, and providing information about providers and services available in other parts of the state if the participant requests it. The CDDO and TCM may both provide unbiased support to help participants make an informed choice of providers and services, including coordinating and scheduling tours of potential providers. If a participant chooses services outside of their current CDDO area, the current CDDO and the MCO coordinate with the CDDO in the desired area to communicate that choice. CDDOs have to provide options counseling annually, as well as whenever requested by the participant. And if at any time a participant wants to change service providers, the CDDO will help them complete an updated provider choice form, and the TCM will update the person-centered service plan. Once options counseling is complete, the TCM can help the participant access information and support from their chosen providers and facilitate transition meetings between the participant and their chosen providers. If the participant is self-directing any of their services, the TCM will also connect them with an FMS provider and a support broker. And the FMS provider and support broker provide training and assistance on hiring providers. Regarding referral to non-waiver services, the TCM refers the participant to additional community and social supports available to the participant that the MCO may not provide. The TCM also helps identify and coordinate informal and non-paid support options. Additionally, the TCM will refer participants to the MCO to coordinate other state and federal resources that are beyond the scope of the CSW, so things like state plan services and EPSDT and CHIP. TCMs are responsible for communicating participant needs to the MCO whenever this might be necessary. TCMs also have a responsibility for participant education and educate participants on service options, care gaps, assessment, and understanding of risks and strategies to mitigate risks, training opportunities to help the participant become more active in the planning process, the right of the participant to receive services that support choice and to have free choice of providers and services, including the right to self-direct any or all services, the services and supports that are provided by FMS and support brokers, and the CSW budget limit, available funds, and how to use those funds to best meet goals and preferences. Implementation and monitoring of the person-centered service plan is a coordinated effort. It's a responsibility that's shared by TCMs, MCO care coordinators, CDDOs, and KDADs. TCMs are responsible for monitoring the following: the delivery of the service plan, including at least quarterly face-to-face visits with the participant, ensuring providers carry out the service plan in a manner that supports the participant's inclusion in the community, service utilization, the participant's history of decision-making and the safeguards available to them, participant health and safety, and TCMs are also responsible for documenting the participant's progress towards goals of the person-centered plan. MCO care coordinators are responsible for ensuring the following: that the person-centered service plans meet all requirements, including setting final rule requirements, that all forms, including choice and rights and responsibilities forms, are completed and submitted, and that TCMs have been documenting the participants' progress toward the goals identified in their person-centered service plan. CDDOs are responsible for monitoring and overseeing providers' delivery of services approved in the participant service plan and the compliance of their affiliated providers with regulatory standards, including the setting's final rule. CDDOs conduct quality reviews of affiliated providers whenever a participant, MCO, TCM, or KDADS makes a complaint or identifies a concern. And CDDOs can also help participants choose alternative service providers if ever desired. KDAD's quality assurance team reviews a representative sample of waiver participants' case files to ensure accuracy and appropriateness of the service plan and to identify areas for remediation and improvement. And KDADS also has a settings final rule monitoring team that monitors for compliance with that final rule. On an annual basis, a participant's functional eligibility will need to be reassessed as it expires every year. And so before it expires, the CDDO will complete a reassessment to determine that the participant is still eligible for the waiver. The TCM will then schedule a person-centered service plan meeting with the participant, their care coordinator, and anyone else the participant wants there. And at this meeting, they review and update the person-centered service plan as needed. So I know that was an awful lot of information I just threw at you all. I will pause here to take any questions or comments. So I'll throw it to you, Peter.
Yeah, we have at least two in the chat right now, Ellie, and they're the same question. So just to put a pin on this one, Will individuals be required to have a TCM under the CSW?
I will throw that question to Michelle, if that's okay.
Mhm.
So, Killian, or no, you weren't asking the question. The question was, are you required to have a TCM?
Right.
It's not a required service. However, if you're going to navigate through all the services, the CDDO and the MCO, and KDADS, you're probably going to need help with that with the targeted case manager. Otherwise, that would fall to the CDDO, and they are, we strongly encourage people to get a TCM to help them navigate, get the support service plan up and running. I don't know if I've answered your question. I just think it would be hard to access services if you don't have the support of a targeted case manager.
Yeah, Michelle, I think that's a reasonable answer. And to attendees who asked, if there's more specific information you'd like, please feel free to just submit another question. Michelle, this next one's going to be for you as well. This is a question from Kirsten asking for options counseling. If we're able to share, or I should say is KDADS able to share when the RFP will be issued for FMS support services under the CSW?
Yeah, sure. So we are in the process of going into our procurement process. We are expecting it to be posted in about 30 days from now. We have a very extensive procurement process, and we've had some new points that we need to go back and do, which we have done. Very stringent guidelines on how we put an RFP out. It's taken a little longer than we'd hoped, but we do expect it'll get completely through the process in the next 30 days.
Thank you, Michelle. Just reading through the next question now. Okay, so Craig is asking about funding limits under the CSW. Basically asking, what would happen if an individual approaches or exceeds that 20K budget limit? Does that mean, they lose services for the remainder of the year? Would they be eligible for the IDD? More or less, Craig's asking what happens once you hit that 20K cap.
Yeah, Craig, we're looking at that. We don't want to be pushing someone to the IDD waiver if they're a few thousand over 1 year, for the first year or something. So we're looking at how we manage within our appropriation. But we're developing some guidelines around that. We are aware that, people's costs are going to vary year to year. And we want to keep the folks on the community support waiver whenever we can.
Thank you, Michelle. Appreciate you taking that one. Jackie, I think I'm throwing this next one to you. What is the difference in what an FMS provider does versus the support broker?
Yeah, thanks. So on the CSW, the FMS provider will employ support brokers. So the support broker would be a title of employee within the FMS provider agency. The support broker would be more of that like one-on-one, the participant who's self-directing their services meets with their support broker to really talk through their particular circumstances, and the support broker is able to get them the training and assistance that they need in hiring individuals to provide their services and to kind of manage their budget. The FMS provider, like overall, also is going to help participants who self-direct their services do all the administrative functions, like paying out providers that the participant has hired, collecting and withholding the appropriate taxes and things like that. kind of serving as that administrative arm for the participants, so they don't actually have to be the ones filing the tax paperwork, paying out for services, etc. So I hope that answers the question, but if it doesn't, feel free to add another question into the Q&A.
Thank you, Jackie. And as I recall, this was a subject for a previous town hall. Am I remembering that right?
Yeah, we did have a town hall about Appendix E, which is all about self-direction and what the FMS responsibilities would be, what the support broker will do. I'll go ahead and put the link to that town hall slide deck in the chat for everybody to review.
Excellent. Thank you, Jackie. So, anonymous attendee, whoever asked, if you do want just a little bit more information around this topic, that town hall would be the place to go to get it. Elian, I think this next question is for you. I'll just read it out quickly. An anonymous attendee is asking if the person-centered service plan annual meeting will be combined with the MIFI assessment and the MCO, so there's one meeting instead of several meetings. So just so I don't embarrass myself trying it, if you would please also explain what MIFI stands for as well in your answer, I think people would appreciate that.
Yeah, thanks, Peter. It's a great question. So the MIFI is the Medicaid Functional Eligibility Instrument. It's the tool that CDDOs will use to assess a participant's eligibility. And I guess just to clarify here, so the intent of this kind of reorganization of responsibilities is in part to streamline the process and simplify it for participants so that they aren't required to attend quite so many meetings. So ideally, kind of the structure we'd see is that the MIFI is conducted by the CDDO, and then once the person is determined eligible for the waiver and able to enroll, then the MCO will complete the needs assessment using the Inter-RAI tool. Now, this assessment has to be completed prior to the service plan, but ideally it would be all in one meeting. So a person would get their needs assessment completed with the Inter-RAI tool with their care coordinator in the same meeting that they are then getting their service plan developed with their TCM. That said, if that's not possible for any kind of scheduling reasons, say the MCO has a conflict or there's some other issue there, then the Inter-RAI just needs to be completed prior to that service plan meeting. If that didn't answer the question, feel free to raise your hand or put it in the chat, and I'm happy to provide some more detail here.
Thank you, Elian. We've hit a lull in the questions for now, so I will do my usual plugs. We've mentioned the Kansas CSW website and the previous town halls a few times now. I encourage everybody, if you haven't, just go and explore that website for a little while. It has a lot of information that we just can't cover in every town hall because there's just too much. But there you can find more details on the CSW, including lists of services and some summaries of appendices that KDAS has finished drafts on. You also have an opportunity to send any feedback or reach out to us with future questions. I know this meeting is focused on the CSW, but we've mentioned Conflict-Free Kansas and that initiative a few times as well. I've posted the webpage for the PAT in the chat, but there's a whole rest of the website about conflicts of interest, CMS's rulings on them, previous PAT meeting notes, a whole bunch of stuff about that initiative if you're more interested. And I encourage anyone, if you haven't signed up for that mailing list as well, that's a great way to stay up to date on what's happening there. So with that said, Elian Marlowe is just asking for a little clarification if that would be 1 or 2 meetings in what you ultimately listed.
Got it. Yeah. So the MIFI assessment happens prior to waiver enrollment. That's used to allow somebody to determine if they are eligible to enroll in the waiver. So that is sort of one meeting with the CDDO. Once a person has been approved to enroll, they've been determined completely eligible for the waiver, then they would have a meeting, ideally just one, as you're saying, with the MCO care coordinator and the TCM present. And at that meeting, the MCO would conduct the needs assessment using the InterRAI tool, and the TCM would develop the service plan. So ideally, that all happens in one sitting. Now that that's not mandated though. If needed for any reason, the person can have one meeting with their care coordinator to complete the needs assessment, and then they can have a subsequent meeting with their TCM and others to develop the service plan.
Thank you, Elian. We still have 9 minutes left. So we're more than happy to spend all that time answering questions. So please submit any more that you do have.
I'd like to just say that we're very sensitive to the fact that um, people have too many meetings in their lives. And we're going to strongly encourage care coordinators and TCMs to work together to, reduce the amount of meetings folks have to go to and get everything taken care of as much as possible in the fewest amount of meetings necessary. So I think that'll take a while to get everybody on board with that. But we're really hopeful that it'll ease the burden on families.
Thank you, Michelle. And again, any other questions, please go ahead and send them in, or you can raise your hand and we'll give you the option to unmute. Michelle, I think this might be a question for you. It sounds like this is a meeting KDAS is holding, but this is a question from Linda, who asks, they had planned to attend the SCDDO meeting on October 24th about the CSW. Will the content in that meeting be different from what we discussed today? And I guess by extension, what we've discussed in previous town halls?
A meeting on October 24th.
October 24th. Yeah, the acronym Linda dropped in was SCDDO. I'm not sure what that stands for.
Okay, hang on, I'm looking at my calendar. It sounds like it's being held by one of the CDDOs and not
Oh, that would
KDAS.
make sense. Oh, okay. Jeanette Livingston just provided some more clarification. It's the Sedgwick County CDDO Community Council. So I imagine they would have control over that content, not.
That's what I was kind of thinking, but I wanted to make sure it wasn't on my calendar.
Yeah. Linda, unfortunately, I don't think we can answer that for you then. It would depend what Sedgwick County wants to cover in their meeting. We did have a participant, a couple participants raising their hand. We'll go in order. Jessica, if you'd like to go first and ask your question, you should be able to unmute now.
Yeah, I just wanted to respond to the meeting in Sedgwick County. I am doing that, and Robin's attending virtually, and it won't be over this. It'll be a more basic breakdown, going over support broker and the different kind, what the employer self-direction versus agency, and it'll just be a breakdown of all the things that kind of explain some of the basic functions of what we're doing.
Excellent. Thank you, Jessica. I appreciate you jumping in to answer that question for us. Any other questions we can answer in our remaining 5 minutes? Then with that, I will just take a second to thank everybody for attending and for your very constructive questions. As I said, if you have any more, feel free to reach out to us through that Kansas CSW email address or website. Or if you have something specific to the conflict-free work, now that we've talked just slightly about that, feel free to use that website and email address as well. And with that, Audrey, I will throw it to you to close us out.
Awesome. Thanks, Peter, and thank you everyone for joining us today. Our next town hall will be November 19th, so please be on the lookout for an invitation and an announcement via email and also on our website. But that's all from us. Thank you all so much for attending.